Welcome to the Dr. S podcast, Health Tips Weekly, Episode 6, the talk about cracking knuckles and arthritis with Dr. Tan. Hi everyone, welcome back to another episode of the Dr. S podcast. Today, we have Dr. Tan. He is a medical graduate working at Respire Malaysia, which is located at UMMC Kuala Lumpur. Hi Dr. Tan, thank you for joining the show. Before we start, would you like to tell us more about yourself?
Hi, thank you Charlotte. Hello listeners, hope you are having a great day. I'm Chen Liang, a newly graduated doctor from IMU. Thank you Dr. S for inviting me to this podcast today.
Hi Dr. Tan, thank you for joining us. So today we are going to talk about cracking knuckles. I believe that everyone has cracked their knuckles before, and that must have felt so satisfying for most of the people. So looking into cracking knuckles, how does it actually work and where does the pop sound come from?
The pop sound is actually caused by the nitrogen bubbles bursting in the synovial fluid. You might ask, what is synovial fluid? Synovial fluid is the fluid that helps lubricate the joints. So when you are cracking the knuckles, either by stretching the fingers or bending them backward, it creates a negative pressure and the bubbles pop. It usually takes 15 or 20 minutes for the gas bubbles to dissipate and for the bones of the joint to return to their normal position. So this is why you can't crack the same knuckle twice in a minute.
No wonder. Because I always feel like a relief on my joints when I crack it. And it doesn't feel as tight anymore, but I just can't do it right after or like shortly after. So, we have always heard that cracking knuckles makes them bigger. What do you think about this and what is the science behind that?
There's a long list of myths and superstitions about knuckle cracking. But the one you probably heard the most often was delivered by the irritated parents or teachers when you were a kid. So they will tell, Agda, don't do it. Cracking knuckles will give you arthritis or will make your joints look bigger. But too bad for them, From the conclusion of several studies that compare the rates of hand arthritis among the habitual knuckle crackers and people who didn't crack their knuckles, tell us that it probably won't raise your risk for arthritis. One of the most convincing bits of the evidence suggesting that knuckle cracking is harmless. It comes from the California physician who reported on an experiment he conducted on himself. Over his lifetime, he regularly checked the knuckles of only one hand and he checked x-rays on himself after decades of this behavior, and he found no difference in arthritis between his hands. And after that, a larger study came to a similar conclusion as well.
Okay, so here comes the million-dollar question. Does cracking knuckles actually cause arthritis?
The short answer is actually no, just like what I told you just now. But let me tell you more about arthritis. So arthritis is an inflammation of the joints. It can affect one joint or multiple joints. There are more than 100 types of arthritis, and the two of the most common types are osteoarthritis and rheumatoid arthritis. So the degenerative arthritis, best known as the osteoarthritis, or we can say is a wear and tear arthritis. The cause for either are not well known, and research focuses on elucidating the mechanisms leading to these diseases. In general, genetic predisposition is highly likely for both. For the inflammatory arthritis, an unknown exposure to environmental stimuli is considered possible. And for the wear and tear arthritis, instead aging and excessive mechanical stress may play a role in accelerating the damage in the joints, as it happens in the knees of genetically predisposed older obese people. So joint pain, stiffness and swelling are the most common symptoms of arthritis. Your range of motion may also decrease, and you may also experience redness of the skin around the joint. So many people with arthritis, they'll notice their symptoms are worse in the morning.
Okay, I see. So, for a person with arthritis, can cracking knuckles or joints make it worse?
No. However, theoretically, knuckle cracking in patients with weak or damaged joints due to arthritis could potentially lead more easily to ligament injury or acute trauma to the joints. So when you're having joint pain or stiffness and swelling, which are the symptoms of arthritis while you crack your knuckles, then you should stop doing it and pay a visit to the hospital.
Okay, I see. Since cracking knuckles doesn't cause any harm, is it okay that we do it then?
The short answer is no, and the long answer is no too. Sorry for the lame joke. Because there are rare medical reports of problems associated with this behavior that may relate to how much force is applied and one's particularly their technique. For example, joint dislocations and tendon injuries has been described after attempts to crack knuckles. One of the studies that published before found that among 74 people who regularly crack their knuckles, their average grip strength was lower, and there were more instances of hand swelling than among 226 people who did not crack their knuckles. So even if knuckle cracking doesn't cause any arthritis, there's still a good reason to let go of the habit. Chronic knuckle cracking may lead to reduced grip strength, and there are at least 2 published reports injuries suffered while people were trying to crack their knuckles.
Well, what about other sounds coming from the joints? Should we be concerned about it?
The origin of most joint, the noises, such as popping sounds or cracking of the knees when you're doing a squat, is uncertain. They may come from the kneecap rubbing on the bones below, or a tendon sliding across an irregular surface. However, in the absence of pain or swelling or the other joint symptoms, these sounds are probably nothing to be concerned about, and there's no reliable way to silence them.
So why do you think that a lot of people just can't let go of this habit?
Just like what you said, sometimes you feel like after cracking the knuckles, you feel like there's a release of tension.
Yeah.
So that's why it is a common behavior that enjoyed by many. And some people just like hearing the sound of knuckle cracking. Some just feel like it's simply an annoying thing that other people do. And then some people think that cracking knuckles makes more room to the joint. However, although it may feel like there's more room, but there's no evidence that there actually is. So once you start cracking your knuckles for any of these reasons, it's easy to keep doing it until it happens without even thinking about it. When you find yourself unconsciously cracking your knuckles many times a day, it's become a habit. People who do it 5 times a day or more, we call it habitual knuckle crackers.
Okay, so now we have concluded that even though cracking knuckles doesn't cause arthritis, but it is still not a good habit, right? So how would you suggest to break the habit?
First thing you need to think about is why you crack your knuckles and address any underlying issues. Then the second thing is to find another way to relieve your stress, such as you can take a deep breath, exercise, or meditation. You can occupy your hands with other stress relievers, such as squeezing a stress ball or rubbing a worry stone.
Okay.
And you can be aware of each time you crack your knuckles and consciously stop the sound. Otherwise, you can wear a rubber band on your wrist and snap it whenever you are about to crack your knuckles. So breaking a habit like cracking your knuckles can be hard, but it can be done. Yes.
Okay, so like just being aware of what you're doing and finding other ways to release stress, do things that can help to kick the habit, right?
Yeah.
So is there any symptoms that would warrant the people to go to the doctors when they crack the knuckles? Like if they experience anything, they have to go to the doctors?
Yeah, if they experience any pain or like they realize there's some bruises or like any redness around their joints, they can't grip things firmly, then they should go to a doctor.
Okay, but will it cause any really serious complication though?
It can cause some ligament injury, it can cause some tendon injuries, but then there's reports, reported that there are some cases have dislocations or any tendon injuries, but then it's not common, but it can happen.
Okay, to the listeners, bear in mind that even though cracking knuckles doesn't cause arthritis based on the studies found, but it is important to note that it can potentially cause injuries and reduce grip strength, which Dr. Tan would definitely suggest to break the habit. So that concludes our show today. Thank you, Dr. Tan, for being with us here to share about cracking knuckles and debunk some myths about that. It was definitely an informative session, and I hope it was for you guys who are listening as well. So before we end this episode, Dr. Tan, do you have anything else that you would like to advise the audience?
I think that's all. You concluded quite well.
Okay, thank you. Once again, thanks Dr. Tan for the insightful sharing, and I'm sure that all of us have gained from this. That's it for this week. Please stay safe and healthy. If not, you can always talk to us on Doc to Us.